My name is Vice President Willie Lightfoot of City Council. I'm joined with many members of my City Council, which is Michael Patterson, Mitch Gruber, Malik Evans, Lachey Harris, Jose Pio, and as well as our staff. And we have a wonderful work session for us this evening. We, of course, with all of the civil unrest and the various things that we have going on within our community, we have been working diligently, thanks to the mayor and the administration, to try to address some of these issues with redirecting some of our attention towards human services and the work around human services. With that being said, we have Commissioner Torres with us today and some of her staff whom she will introduce. And I'm so glad and looking forward to hearing this presentation. And at this time, I'll turn it over to Dr. Torres.
Thank you very much, and good afternoon to all of you. I will start out with introducing the team. I would like to first introduce Erica Hernandez, who some of you may know from her many different roles that she's had with the city, but right now she has taken a role with our department as an Associate Director of Community Services, and her role is going to be critical because we need to make sure that we have leadership and stewardship of the administration of this new office that I'm going to be talking to you about today. So Erica, if you would give a wave.
Hello, everyone. Good evening.
Next, I would like to introduce Aaliyah Henton-Williams. And Aaliyah is our coordinator, our comprehensive crisis response coordinator. And she's been with us about 3.5 weeks, and it feels like forever. She's hit the ground running and done a tremendous job. Formerly was a part of the victim assistance unit prior to joining us in this role. So she brings with her a great deal of experience in the work, but also in the team transition. So, Aaliyah. Oh, you were muted, but we got your wave. I would also like to introduce Dr. Jason Willis, who has joined us in July as our Director of Youth Services Bureau, where our Pathways to Peace program is housed and has been housed. And Dr. Willis has a great deal of experience. Many of you may remember his work as a part of evaluating the Pathways to Peace program while he was with RIT. And most recently came to us from his tenure at the school district in his work with MBK as well. Dr. Willis. And then last but certainly not least on my screen is Melvin Cross, who I would like to introduce as the new manager of youth violence prevention and outreach, and also known as Pathways to Peace. And Melvin also hit the ground running right during COVID, taking over as Ray transitioned to a different role in the department, and has been, definitely out there. And many of you have probably seen him and engaged with him during all of the events that have been occurring. So Melvin.
Good evening and hello, everyone.
Good evening.
So thank you to you all for meeting this team, and I hope this gives you an opportunity to understand a little bit more about who's doing some of this work. At this time,
Dr. just real quickly, excuse me. I just want to say, just based on that, just looking at your team is pretty impressive. I just want to say that I want to make sure that the community, many of you are highly recognized and respected in this community. So I just wanted to take a time out to make that note. Thank you.
No, thank you. They certainly are. We do have a great leadership group working on these issues and working to serve our community. So if it's all right with you, I will share my screen and begin. I have some slides to provide an update today on the Crisis Intervention Services Office. So I'll go through some slides and then I will take your questions. I think many of you recall from our conversation with council as we talked about the initial part of this plan, which you approved in the transfer of both funds and in the transfer of some offices and programs from RPD to our department. You knew at the time that we were talking about a different approach, a comprehensive community-based response to support specifically victims and families dealing with homicides, mental health, domestic violence, and other crises. The key here is on mobilizing highly trained professionals, which will include counselors and social workers, as well as many of our community-based organizations, as we'll talk about, to be sure that we are connecting people to the services that they need. And we know that there are a number of services in Rochester and in our community, but we also know that there's a connectivity issue, and that has been highlighted in a way that has created a sense of urgency in our community around making sure that we organize and coordinate better and make connections more quickly and more directly to people. There have been many organizations across, and I call attention to kind of this sample process that I have on the screen. There have been many reports that have been a part of this work, and a report published just a couple of weeks ago that Councilmember Lupien actually shared with us as part of her work that she's been doing. And it's the Portland response, and it has been something that we have been looking at, and I'll talk a little bit more about what we've been looking at. But first, I want to make sure that I clarify some things, because I have heard many things being used interchangeably in our community about programs and services and how things might work. And I want to make sure that I'm clear about the connectivity of the system. So what we're talking about with this Office of Crisis Intervention Services is really a part of a broader system. It will have its discrete function, but it is a part of a system and is connected in every way to all of the rest of the system. So Monroe County Services, which includes FIT and the Office of Mental Health, those are Monroe County services that we will continue to work with and collaborate with. And I could talk about that more specifically when we get into the crisis response team, but it is not interchangeable with FACET and other words that have been sometimes used interchangeably. And we're going to be working to make sure that not only internally we understand that, but that the community does as well. And that's part of what I'll be talking about later when I do talk to the community. And then there's also needs to be a recognition that there's a layer of community-based providers that work in this system, that support people, as well as the health systems that we traditionally think of, the hospitals that support people, but there are layers of supports. The entry to the system has either come from 911 or 211 Lifeline, or in many cases through public safety, whether that be police, fire, or EMS. So looking at the connectivity of the system has been critical in understanding what role crisis intervention services will play and making sure that it doesn't duplicate, but that it leverages the resources that the rest of the system has. So now I'll talk specifically about the Crisis Intervention Services Office, which has 4 components to it, 2 of which you approved legislation to transfer to our department from RPD. And those were Family Crisis Intervention Team and the Victims Assistance Unit. Now, both of these programs have been around for many years and have provided distinct services. Family Crisis Intervention Team provides counseling to victims and people in crisis directly after the crisis has occurred. They assess and make referrals and coordinate in short-term follow-up and short-term case management ways. Victims Assistance deals with people who have been victims of a crime and needs help either navigating support navigating hospital visits, the justice system, or funding that they may be entitled to have access to as a part of their status as a victim. And both of these programs have traditionally been dispatched and enacted by RPD as a part of their work. And so we'll talk a little bit about how that part of how they get their work will change in some ways, but the work that they do is outlined here. And I'll talk again about what it means when they transfer into this office. The homicide response team, which I'll also delve into a little bit more specifically, and certainly Vice President Lightfoot can speak to as well, is going to be a 4 to 6 member team that responds to families, families of victims, and connect them to services. And so there will be instances where that team makes connections to Facet, and they make connections to the Victims Assistance Unit, and as well as the partners that are involved in that work being the ones that provide grief services, mediation, and work to prevent retaliation or continued violence, which we've had some experience with the team doing some of this work preliminarily with recent events that have happened. And then lastly, the crisis response team, which is being formed as that alternative response to mental health and domestic violence calls. And I'll talk a little bit more about that model in just a second, with the team being comprised of emergency response social workers and EMS. And we are working on how they will get their work from 911 and how that will work, because there are many complicated layers to that. As the members on this call who are a part of the work group can attest to, there are many components to what we're doing. But for each one, I want to delve in a little bit more specifically to give you an update. The Facet Victims Assistance transition, I want to be clear that when you voted to make the move happen, that started a process, that triggered a process that is called a transfer of function process. It's a civil service process. It requires a period of posting and allowing the members of that team to understand what is happening and to decide whether they want to sign on to do that. At this time, all of the members of the team have signed on to do the transfer, but the process timeline has a clock. And so that transfer will be official on the 26th, on Monday, the 26th. Their transfer of supervision will be officially set. So up until that point, I've really been working with them to understand what needs to happen as a part of the transition, but the transition hasn't happened just yet. They have in their budget, they have 17.9 FTEs, but there are about 22 actual personnel that make up that FTE count. Their programs do have predefined scopes. Some of that come from the grants that they are funded by and with, and some of it comes from pre-existing job descriptions and workflows that we will be evaluating, but will come over to our department as they are. And that is a part of the transfer of functions process that I also want to be clear about. The director of HR and I have both met with the unit supervisors for the two teams, as well as both teams, the entire teams. And we've outlined questions, concerns, comments that they have, and talked through how we will address the challenges that are logistic and operational in nature around their transfer. So we have received all of the items that they have thought of, and they have been a thoughtful part of the process in identifying what transition issues there will be, and we have been working on them. Erica specifically, who I introduced earlier, is tasked working with the unit supervisors on these detailed transition plans, a lot which have to do with technology and other pieces that they need to maintain access to for their work. Their relocation to 57 St. Paul, where our department is housed, will happen. We're working with DES to prepare the space. We're hoping to have that space prepared by the end of the year to have them moved in and working in their new workflow that way. But on the 26th, when the transfer happens, they will still be located where they were, as the space at 57 St. Paul is not ready just yet. And we will be continuing to work with them where they will be. Next, I'll talk a little bit about the homicide response team in detail. You're all familiar, I know, with the Rock Against Gun Violence Coalition and the tremendous amount of work that has gone into pulling together partners, largely community-based organizations, some of our own programs, and other partners that we work with. And this coalition has been meeting since 2018 specifically about these needs, the needs of the community when it comes to responding to homicides, and the need for this team, which we've been working to formulate. The members of the Rock Against Gun Violence Coalition that have been working really hard on this plan include RPD and the Pathways to Peace, which I have represented here on the call. SERVE, which is a project out of RIT, which has been very helpful in connecting resources to victims and resources to the community. Rock the Peace, Rise Up Rochester, Save Our Youth, and the Rochester Youth Violence Partnership out of Rochester, U of R. And so all of these groups have been meeting and will make up the membership of the homicide response team. And this is something that they have been doing without coordination necessarily in the past, but now with Aaliyah on board, there will be a new level of coordination that we can make sure we're connecting victims and families to supports and services that they need. I know many council members were involved in responding to the community with the mass shooting that occurred. And I know that many of you I spoke to because there were a lot of different things going on. And one of the things we want to make sure we're able to do better is to have this coordination that while we did respond, we certainly could have seen the need for being able to be better coordinated in knowing who is addressing the needs of each individual victim's families, how those needs are being met, and making sure that we can report out what has been offered in terms of supports and services. So there definitely needs to be this coordination with this group, but all of these members make up that team. And then the final part that I'll talk about in detail before kind of summarizing and taking your questions is the crisis response team. So the crisis response team has been looking at a number of different models, and you may have heard of some of these models in different community forums. And I know, some of you know more about this than others. Excuse me, I had to get some water. Councilmember Lupian, if you wouldn't mind saying a few words about the CAHOOTS model while I get my water here, I would appreciate that.
Sure. CAHOOTS is out of Eugene, Oregon. I know we've talked about that on council a little bit. They are a non-officer response. They are dispatched from 911, although I think they do have their own phone number, but predominantly their calls come from 911. And they send folks out to the scene. And then, if they need police assistance, they are able to call for backup.
Thank you for that. And their model, they have shared with us in a variety of forums. we've had public forums, but we've also had individual conversations with them about their model. And I think one of the most important pieces of the work in preparing for the crisis response team has been in the development of a comprehensive advisory committee, of which Councilmember Lupien and Councilmember Harris are both serving on, which I'm very grateful for. Councilmember Harris has done a great job in connecting us to EMS, because EMS in this model is the partner. And that's the public safety partner that at this time the advisory committee has been really focused on, because it's been a model that's worked. And it's a model that is the alternative that we were specifically responding to community requests for. So we have a comprehensive advisory committee that is working on details around 911 call screening and diversion, what the response team will do with their protocols and the training that they will require, as well as building the care network and how we will connect people to services as we come in contact with them. My apologies. They turned the heat on in here today, so it's a little hot over here. So just to recap before I take your questions, the path forward, where are we? So I talked about the transition with the two groups that are moving into the department. The homicide response team, because it was in the works, is ready to launch. And in fact, the first training of the group was held this week. So training has started. We'll continue on into November, and the team will be ready to launch in November. And I will let Aaliyah speak a little about that when we get to questions. And the crisis response team, we have hired the initial emergency response social workers who will begin in a couple of weeks. And the advisory committee is working on a timeline where they will have a pilot plan completed in a 90-day mark, which is in correspondence with what the county is also trying to do in a 90-day plan development cycle, which would take us to having a pilot plan developed by the end of December. So the team is working very hard. There are many layers to what we're doing. And this is the path forward that we have. This evening, we will also be giving an update to the community and being able to take their questions. So while I understood that the community could watch this session, they wouldn't have an opportunity to necessarily ask questions. So we will be doing that this evening. So at this time, I will take your questions.
I have a question. Can you talk a little bit about, well, two questions. First part is, currently right now, if there is a mental health issue, I'll give you a scenario. Let's say it's 11 o'clock at night. There's a mental health issue, a call goes into 911. What happens now? And will it be different based upon this, or is the process already in place to deal with mental health calls differently?
So it depends on the acuity of the call, right? So there are screening factors that 911 would apply to that call in your scenario today. And those screening factors would determine how that call might be routed. But one of the challenges is, the availability and connectivity of who might respond to that. So that's what we're really trying to deal with, is we're trying to create, a common community response that can be, that can be counted on, that people know that's going to be the response and that response will be available. So there are a lot of factors on which services operate at which times, which response teams would be able to go out based on certain call criterias. And that's something that hasn't been coordinated at a level that we're looking to make sure that we coordinate for city responses. And again, we can only control city responses, but that is what we're looking to coordinate.
But so right now on a city response, would a mental health professional, social worker go out on a call now, or?
So it depends on, there's a possibility that that could happen now. The
Okay.
possibility would be if the county fit was available and enacted and that the call met that criteria, but that would have to be in conjunction with law enforcement or called by law enforcement. Or right now it could be Facet, but again, that would have to be RPD that dispatch them. So the RPD would get dispatched and then be making that call.
Okay, and then my last talk to me about talk to me about the interplay between RPD, Facet, and then the county's fit. How is, because that's the confusion that I think a lot of people have. How does that interplay work? Like what role does the county play there? What role is the city there? How does that work?
So FIT is the county's program.
Right.
That program partners mental health counselors with law enforcement officers. And so in the city, if FIT was requested, that would be something that would happen from 911 through RPD. And RPD would make that request. The same would be this with Facet. So if it was something that RPD determined would best fit with Facet counselors, they would make that call. So one thing that's important about the connection between FIT and Facet is many of the services that those mental health counselors provide are the same, but it's about how they get to people, when they get to people, and then what do they do with the casework after that. Largely, the county would defer to the city for the city to respond to the city first. So if Facet would be available, then Facet would respond. If Facet's not available and FIT is, then FIT would respond. And so because the city is a part of the county certainly will provide the support, but it does so after the city asset was checked for availability and or deployed.
Okay, I'm sorry. This is my last point. I promise. A question. So do we need to, and maybe we can follow up. Maybe Vice President Lightfoot can follow up with this as Chair of Public Safety. Do we have to? So do we need to be having conversations with 911 and RPD, about the way those calls are categorized and sent out, and how that whole process works?
Absolutely.
Or will work going forward?
Absolutely, and that's what we're doing right now. So 911 team members are a part of the work. They're a part of the city's advisory, committee and work
Right.
group. And I'm a part of the county work group, and 911's also a part of the county work group. So we're all working on this, as well as, RPD is definitely still a part of everything that we're talking about. And law enforcement is a part of what we're talking about, because public safety has a role in, there's a decision tree that will dictate where calls go, and acuity levels. And there's a great deal of detail surrounding protocols around dispatch and protocols around assessment of those calls. So we, Councilmember Lupien's on the call, or yes, there she is. We just had an hour-long conversation about this in our advisory group today that is targeting this, and we're combining our efforts with 911 in the county, specifically on this. So all of those folks are at the table. We are working with them, and that's how we have to develop these very detailed protocols.
Okay, thank you.
Yeah.
Quick question. So based upon Councilmember Evans' scenario, it sounds as though currently the deployment of additional services around a mental health call would happen in the way that they have traditionally happened. You are still working on formulating the new protocols on who, when, where, what, how. Is that correct?
Absolutely.
Okay, thank you.
So I have a quick question too. Often with trauma or mental health concerns, there's comorbidity with or addiction. And I know that the county just hired an addiction services director, and they're going to be hiring 6 outreach workers to work countywide. How will this interface with that, or has there been any conversations around that yet?
We have talked about that in the county work group, because the county is working on the same thing that we are, but again, in that nesting kind of overarching way. So we have talked about that, and we're talking about how all of these resources will connect and how they'll be leveraged instead of duplicated. One of the things we've been really very specifically talking about is how can we work together to have the right clinicians, either developing the protocols for 911 or doing those protocols for 911. How do we work together to do that in the same way that the city and county works together to have 911 services as it is, because we really can't have 2 of those. And so what you're describing, all of the resources that they're putting in, we will make sure that they're a part of the care network that we're building. So that's one of the teams that we have, is working on building the care network, which is how we connect people to service. And that is exactly, that just came up today, that group you're talking about.
Can I ask a question about, well, actually, first of all, let me say thank you, Commissioner Lyman Torres, and I agree with Councilmember Lightfoot's comment that you should be boastful of the team you've put together. I do worry about you drinking enough water. You have a lot of speaking to do tonight. So please make sure that you properly hydrate after this. My question for you is related to what Councilmember Patterson and Evans were starting, which is around, thinking through the process that's going to change over time. One thing that's always kind of I guess frustrated me is what seems like a real lack of connection between 911, 311, and 211. There's a lot of 11s, and there's a lot of ways that people ultimately call in for services. And I remember there was a time where I asked 911 operators what they knew about. They didn't even know 211 was a thing, and it may be vice versa as well. And I think this is really problematic, because the truth is that all the stuff you're talking about right now is the back end, and it's really important. I commend you and Councilmember Lupien and Councilmember Harris and everyone else for the work on it. But what matters is that the people who need the service know where to call and also trust where to call. And so I'm wondering if you can just give a little bit of a sense of kind of how you intend to build those synergies and build that level of trust.
Well, we also talked about just what you said today as well, that there's a number of numbers, and we want to make sure that what we do is clear. 211 Lifeline is a part of the work groups, both for the city and the county as well. So they're at the table brainstorming and making sure that we're doing this together. What I can tell you that Cahoots has shared with us is that while they've had their own number for crisis services for the 30 years they've been doing this, most of their calls come from 911. So people have learned 911. We don't want them to unlearn 911. We want to make sure that we can manage the calls on the other end. So I think that 211 is going to continue to be a part of that because they have the Lifeline connection. There's some new national mental health and suicide numbers coming up as well that will be pushed out across the country. But in our region, we're fortunate that 211 Lifeline will handle that. So our community doesn't have to remember another number so that we can try to keep this consistency. So what we will do is we're not looking to create another number, right? So we're looking to work with 211 Lifeline and 911. And I do think that it's going to be both. Because I think that there are already calls that we would respond to going to both. So we definitely will continue to do that as opposed to creating a third hotline or some other number that people would respond to. So we'll stay focused on 211 and 911.
I'd imagine 311 too sometimes gets calls that probably would be applicable. Is that not right?
Well, I talked to, Director Soretto about 311. He doesn't feel that that's the right venue. But certainly when they're open and taking calls and they get something that's not for them, they do reroute that and would continue to do that. So we'll continue to kind of stay away from 311 for this purpose.
Got it. But ultimately, as a new process gets created, there will be full cross training for operators of 911 and 211. And I guess that's all I'm saying is I would hope that when those cross trainings happen, it can't hurt to also cross train 311 operators, because what we want is easy access points for anyone to be able to make these calls, and for the operators, wherever they may be, to be able to potentially put them into the right places.
Yeah, I hear you.
Thank you.
I know I got another question about the transition of the staff as well, and I want to make sure that I just reiterate what we've received and what we've done. So we know that there have been a number of questions about the transfer and about the transfer process and what it will look like logistically and operationally. We've received that information from the employees directly, from some of you, and also from the union that represents them. And we have met with the staff and the supervisors, and we've worked through that. So we will continue to do that. We will continue to work through the questions that are operational questions, the concerns. We had to really work through getting to a point where the transfer itself was going to happen, and we had to get past talking about not doing that because that particular decision had already been made. There's change is difficult and challenging for everyone, especially programs that may have been operating for a long time in one particular way, as well as, there is an acculturation to RPD that these teams have. And that has to be a part of the transition as well, that we have a different service model in a human services kind of function than is in law enforcement. And so some of that is part of the transition that has to be navigated also. And I think that, I've shared openly with them in our meetings and you in our meetings as well, that the community has said to me that they didn't know enough about these services, and in some cases at all. And whether that's real or perceived, it's the community's perception, and that's what we have to address. And that's been a pervasive issue is the visibility, the connectivity to the community, and we will be addressing that with this transition.
Thank you, Commissioner Torres. Any other questions? I think this is amazing. This is a three-legged stool, as we're seeing: a family crisis intervention team, victim assistance, homicide response team, and crisis response team. I need to see a smile out of Mary's face. I really do. Okay, there we go. Okay, so I'm looking for something better than cahoots is what I'm looking for. I'm looking to raise the bar and take it to another level. I appreciate the work that they've done, but I think they've had enough research and time to do this that I think we can capitalize off of some of their mistakes and some of the things that they've done. Not to take anything away from them, it's just that they did it longer, and that's what the benefit of having the research and the data behind what they did, so we can try to make our program better based on their mistakes. And so I agree, the 311, 211, 911, we definitely don't need another number. Even with the Rock Against Gun Violence Coalition, we did create we had a number that we put out on our billboards, and we get very few calls to that number. So clearly people don't want another number. They like calling the numbers that they've been calling, and I think 911 is that's where it's going to get very interesting. And I agree with Councilmember Gruber and others that we're really going to have to work on our protocols around mental health calls, around domestic violence calls, around these crisis calls, because oftentimes, and in the past, 911, when people call 911, especially when you wanted victims assistance or FACET, as you said before, Commissioner, they had to be dispatched by RPD. That's going to be the most critical game changer of this whole program, is when 911 is able to dispatch based on new protocols, policies, these particular interventions, as opposed to waiting for RPD to have to make those calls. So I'm very excited about this work. I'm very excited about the direction that we're moving on in. I believe that, I know, not believe, I know, based on the thousands, hundreds and thousands of emails that myself and my colleagues have received around doing this exact specific work. So I think it's important that the community understands, because oftentimes we hear that the community voice is not heard. In this case, I think we all can attest to the fact that the community's voice has been heard loud and clear, and the action on it has been instant, immediately, from their voices being heard. It didn't take another 6 months, didn't take us to go get a review from some other department or some outside force. It didn't take no long process and a long plan. It just got done. And so I appreciate Commissioner Torres for you getting it done. I know you and your team have to go. I'm going to give you, if no one else has, oh, we got Councilmember Patterson. Go ahead. Before we leave, though, Commissioner Torres, and it would be Councilmember Patterson, then Councilmember Lupia. Before we leave, I want you to give a plug for your meeting tonight, so people that are listening now will know about what's happening tonight as well, too. Councilmember Patterson.
Okay, so I'm happy to hear that you've worked with the staff on the proposed changes, but I guess a bit more detail, if you can answer the question. Have there been changes in work rules, hours? Have there been changes proposed that quite honestly need to be negotiated with the union? Have they agreed to those changes?
There have been no changes to terms or conditions of employment. So there's been nothing that needed to be negotiated, only notification of the transfer. At this time, the job descriptions, work hours, and days will remain the same.
Okay, thank you.
Yeah, I just wanted to comment on Councilmember Vice President Lightfoot's comment that it needs to be better than cahoots. And on the call earlier today, Commissioner Lyman Torres told us of the question that she had asked cahoots when she was talking with them. If you could do it over, if you could have resources, what would you do differently? And I thought that that was a really, it was an impressive question, because it really gets to the heart of, we do want to do this, but we want to learn from the mistakes or, the experience of Whiteberry Clinic. And I think, I can mention one of the things that they said was that they would have clinicians at the 911 call center. And that was something that we talked about, what are the logistics of it? And there's some challenges there, but if we have the will to do some of the things that would make us better than cahoots, it might take a little bit extra money, but I certainly support that.
Thank you. And I do want to be clear that, we are not, trying to directly replicate Eugene, Oregon, because Eugene, Oregon is not Rochester, New York. And we will take from it and build our own model. But we definitely need to, use what they have learned and their experience to our benefit, because that has been helpful. And they're doing that with Portland right now and some other cities as well. So we need to use it, but it's not going to be a lift up and be our model. We will be developing a Rochester model that is specific to our Rochester uniqueness. And then I will say, as you've asked Vice President Lightfoot, we are doing an information update for the community at 6:30. It is going to be on live web stream on Facebook and YouTube. But also, if you want to join in, there's a registration process. You can find that at cityofrochester.gov/crisis intervention. And on that landing page, you can register to be a part and ask questions. There will be a Q&A portion, and I will drink a lot of water. And I thank you for entertaining. It's been a long day of Zoom meetings.
Thank you. Councilmember Pio?
Yeah, just real quick, I'm not a dummy, but I like to keep things simple. I come from that mindset. So having 4 different acronyms, is there, and it seems like a few of them have overlays on top of each other where they work together. Is there something to make that more simple so that when people are thinking about that, or when 911 operators are looking for it on their computer, make it a little bit simple where it's just one team? Or what are your thoughts on that?
We'll look at that. We want to make it simple too. I think that we know that our work, and especially in human services, is very much built on acronyms that can be confusing to the community. So we will take that into consideration and see what we can do.
Thank you. Thank you. Any other questions from our council members and or staff? Anybody have any other questions before we let them go and go get ready for their next event with the community? All right, if none,
I just want to say, I can't wait to meet some of the staff in person. It's one of the worst parts about this whole everything being on Zoom. Hopefully everyone's been onboarded well to the city, and it's great to have such a wonderful dynamic team.
Thank you, Councilmember Gruber and others, Commissioner Torres and your team. We bid you blessings, and we ask that you continue to be safe. And we look forward to, I will be attending your session on tonight, and we ask that all of our council members, please share the link and the information from the city website under the news section with your networks and your social medias. Please get as many people as we possibly can being a part of this conversation as we can this evening. Thank you, everyone. God bless you. All right, blessings.